Hello, Vincent Carroll speaking. This is tutorial number 37, damp heat. In tutorial number 9, I spoke about damp in a very general way. And damp is something that acupuncturists tend to be acutely aware of because, of course, damp is difficult to get rid of. Damp can invade the spleen. Damp can cause all sorts of other problems as well. But when heat enters into the damp tends to be more acute and more obvious and more distressful. So therefore, let's talk about heat in the damp. What do we mean by that? Well, first of all, damp acts as a template to retain heat. Damp descends. It descends into our legs, sometimes with bottlenecks above the knee, but usually in the course of a day, it'll drizzle down. Because what is damp? Damp is fluid outside of the constraints of cell structure. From a Western medical point of view, we would refer to it as extracellular fluid. From an acupuncture medical point of view, we refer to it as damp, but it has the same qualities. It leaks out of the cells, usually because there's not enough of root of post-heaven qi, not enough spleen qi to hold the damp in the cells. So it leaks out of the cells and travels down, and it accumulates, usually just above the ankles bilaterally, and very often people have sock marks, and I often find that's a very useful thing to ask people, have they sock marks? But as I mentioned, the knees provide a choke point in which the extracellular fluid, or the damp as we would call it, sometimes bottlenecks above it, creating heavy, awkward legs, especially as evening progresses. Trying to climb the staircase or something like that can be quite a difficult thing to do. So when heat enters into the damp, it's a whole different ball game. We talk about heat in the damp. I've often come across heat in the damp to such an extent I'm tempted to use the word fire in the damp, but you don't get that expression in the world of acupuncture simply because I suppose, well, a bucket of water never catches fire, and that's in effect what legs become. They become waterlogged with extracellular fluid, and and heat enters into that damp, and heat is retained by the damp, and heat cannot ascend up as heat normally does. So without damp, what happens? Heat travels up, often travels up in the large yang channels, and it manifests on the head in all sorts of different ways, from migraine headache to tinnitus to scratchy eyes to a scratchy scalp to TMJ to ulcers on your tongue to a whole range of trigeminal neuralgia, all these sort of things that give an indication that heat is rising in the yang channels. But if there's damp, heat will be trapped in the damp and won't rise. So the clinical manifestations won't be from the shoulders up. The clinical manifestations will be where the damp is, which might be right down on the sole of your foot. Plantar fasciitis, for example. I find plantar fasciitis to be nothing more than trapped damp. So how do you get rid of it? Well, you treat the damp and you treat locally, and we'll be coming on to that in a moment. But what about higher up? What about your legs? Sometimes people's legs become sweaty and scratchy and itchy, and people can tear at their legs, creating bleeding on occasion, and that can be a sign of a very intense heat in the damp. But again, it's trapped down there. There might be no signs of heat rising up as you would expect heat to do, but equally a portion of heat can rise up, can attach onto a greater yang channel and travel up, creating all the signs and symptoms of heat higher up as well. It really depends on how much heat that's there, and equally how much damp is in both legs to retain, and also the pelvic floor as well, to retain the heat. Often it's a little bit of both. But the damp can become, if the damp is extensive and if the heat is strong, then in that case, the signs and symptoms can be quite distressing, and the person can tear away at their legs, creating bleeding and creating long scratch marks with the possibility of a secondary infection as well. So plantar fasciitis would be one example, but also very often legs as well, scratchy and itchy, and also pelvic infections leading to various discharges, urinary tract infections, gynae infections, so on and so forth, leading to perhaps foul type discharges. These can be a sign of heat in the damp as well. But movement, itch, is one of the things that you notice more than anything else, and scratch. So where does the heat come from? Well, most heat, of course, comes internally, doesn't it, for most of us? I mean, it could be our liver in overdrive, your heart heat as well. But very often it's liver that is in overdrive, creating a liver qi stagnation, and that creates a sense of entrapment, and entrapment might create a sense of anger, and heat rises or yang rises in the channel, and we're used to that as a scenario. But equally, heat can come come from the exterior as well. I mean, if a person kneeled on a rusty nail, for example, got bitten by a mosquito or whatever, what's that? Well, that's heat from the exterior. And it only sort of becomes a problem simply because there's an immediate template for that heat to attach to. And that template often is damp. So heat in the damp can come from the exterior, and heat in the damp can, of course, be interiorly generated. It can be a bit of both, of course, as well. Sometimes a person might have intense heat in the damp. I mean, how would you describe, for example, gout on the big toe? I mean, again, it's a dead end. It's a cul-de-sac, isn't it? So if there is sort of damp there, that damp will evaporate. It'll crystallize. So there will be an intense heat and the sign of crystals as the sensation, as the joint is articulated. The first metatarsal phalangeal joint is brought up and down. It'll create as if there are crystals there. And again, that's a sign of evaporated damp, but it's a sure sign of heat because the pain is absolutely intense in gout. Going more proximally, you're into the sole of the foot. And there, of course, we're talking about plantar fasciitis, and it depends really where the problem is. Very often I find a person might have damp in the sole of the foot, but a person might be walking extensively, giving hammer blows to the calcaneus bone on the ground, maybe poor footwear or something like that. And that repetitive action can generate heat. It's a local heat. Would you call it an external heat? I think you probably could, even though there's no actual piercing of the skin. But it's not a mental emotional heat. That's not internally generated. So I'm quite happy to call it an external heat. It hardly matters because two things have to be got rid of, heat and damp regardless. So what do? Well, you needle distally, you needle locally. I mean, spleen 9 bilaterally, of course, is our great point to get rid of damp, but it has to be done a few times because damp lingers and damp is difficult to get rid of. Of course, Tronophyta rutibus heaven chi, spleen 6, stomach 36, ren 12, and probably spleen 3 thrown in as well. Just to sort of, an efficient spleen means that the spleen will hold fluid and damp won't generate. But you have to take heat out. And I find taking heat out locally is often the best because you're dealing with trapped pockets of heat in trapped pockets of damp or extracellular fluid. And because of the cul-de-sac nature, if you like, of the foot distal to the calcaneus bone, where fasciitis very often forms the arch of the foot. I mean, a kidney 1 is a good local point to actually take out points, but anything up along the sort of side of the foot from from the lateral side of the foot, for example, moving up with the urinary bladder channel, maybe 66, 65, 64, maybe on the medial side of the sole of the foot using the spleen points, or perhaps even kidney points as well, like kidney 2. All these, if needled deeply enough, and if you hit the area correctly, and you have to find out where that area is, where the pocket of damp heat is, to extract it locally. That's very important. So take it out locally, take it out distally, and try to put a remedy in place to prevent the damp occurring. In other words, Tronophyta rutibus heaven chi, that'd be best bet there. Regarding the trouble is, of course, if you take heat, if you take the damp away, if you succeed in getting rid of the damp without getting rid of the heat's only going to enter into greater yang channels and rise, and you solve one problem and create an even perhaps bigger problem. So it's a matter of taking out both together, and I find heat very often can be deep and toxic. So you have to do spleen 10 to take out heat. Of course, you use argentestine 11 or whatever heat points you might like to use. We've no shortage of points to take out heat, but I find a person who has substantial trapped damp heat in the legs very often, all the signs and symptoms of irritability, itch and scratch, it's probably fairly toxic, fairly deep. So you have to do spleen 10 bilaterally, and again, you need to get an immediate bullseye. Very often when you put in needles into damp, there tends to be a dullness, so you have to sometimes search carefully to get the point. Obviously, if a leg is sufficiently expanded where you feel putting in a needle, and when you take the needle out, there will be difficulty in closure of the skin. I have a lady who comes to me like that with really extended legs, and I don't needle down there at all, simply because it would act as a portal for infection to enter in, because when you take out the needle, you might have done a good job, but the trouble is there's still a discharge of exudate where the needle came out, and when that happens, of course, that's a template for infection. So curiously, in her case, the needle or the damp bottlenecks above the malleoli, both lateral and medial malleoli. So I'm quite happy in needling down in spleen 3, source point of the spleen, to tonify the spleen, in her particular case, to try to abolish any form of damp. But it is a struggle, because it is difficult, simply because damp lingers, and damp's very hard to actually drive out. So take heat out, take damp out, needle locally, needle distally. Damp heat is something which will certainly take a person to treatment, be it acupuncture or otherwise, because it is distressing. It is quite tearing. A person will tear themselves in a distressing way, particularly in bed at night, and of course they're very aware that their legs are heavy, and probably different if you compare and contrast with a number of years ago when they mightn't have had that as an issue, so therefore they expect a solution. But from an acupuncture point of view, we're very much equipped to do so, because we're able to take heat out, and with a little bit of patience we're able to take damp out. There's no law against raising a person's legs either, to try to sort of move the fluid into the pelvis, and I often advise a person to elevate up the end of the bed, maybe put 2 or 3 books under the end of the bed to elevate it up a few inches, because when they're in bed at night, the damp can move up rather than move down, and that means that it frees up congestion, and what in fact, as I've often said and have said in this video, is a cul-de-sac where damp can trap and heat can trap, and when that happens, it's often very difficult to get rid of. So anyway, spleen 9 bilaterally, take out locally, tonify the root of post heaven chi, and take out heat wherever you can, including damp, including deep toxic heat. Thank you.